Hello everyone, Dr. Rakhi Dcruz presenting to you the TICO talk. So it was a heavy monsoon day and an elderly lady presented to me with complaints of itching, irritation, and occasional pain in the right eye of 1 week duration. Just looked like a normal case, but something about her lids said that there is something more that I have to suspect. So I took a closer look and I could find the villain hiding there. It was still alive and I could take it completely without removing any of the body parts and intact, and this is what I saw just after removing, the wriggly race. And I became so interested in this. And I encountered 4 more similar cases in that same week, and my curiosity grew quickly. I dived into literature, read every scientific paper I could find, and soon wondered, why not study this myself? So similar types of cases started coming with different types of manifestations like anterior uveitis, conjunctivitis, keratitis, neuroretinitis. So around the same time, some of the friends also posted similar cases in social media. So I called them up, collaborated with them, and started collecting data. Thus came our study, tick and eye manifestation, a study from South India. The secondary outcomes were to find the chances of development of systemic manifestations and to find the efficacy of prophylactic antibiotic in preventing complications. Thus, this paper won me 2 awards, the best free paper in the AOC in the community of ophthalmology and the best poster at AOCCon Delhi. So this is a cross-sectional study. I created a liaison with a local physician and a microbiologist to refer, treat, follow up all these patients and to find the species of the ticks. So ticks, as we all know, are ectoparasitic vectors which can cause serious life-threatening diseases. It is not uncommon here. It is underreported. So it can cause some constitutional symptoms usually appearing after the first week, fever, chills, mild headache, myalgia, which can lead to complications like acute kidney injury, encephalitis, and cardiac involvement. We had 23 eyes. Tick was present in situ in 13 eyes, live in 10 cases. Associated fever developed in 7 cases. Mean period of development of fever was after 7 days. We had 5 cases with non-granulomatous anterior uveitis, which developed 11 days after the tick bite, and there were and so I could identify the species in 11 cases only. Most common species was Ixodes, and the dog tick, Dermacenda. It always led to fever if not given prophylactic treatment. Retinal manifestations were also there. All the patients who had neuroretinitis and other retinal manifestations were sent to the physician to start on doxycycline along with rifampicin and low-dose steroids. Very slow tapering of the steroids were preferred. So what I want to say is, systemic manifestation is not rare. It can happen, but we need to follow up these patients. And even other manifestations like uveitis and retinal involvement is also common. All we need to do, since we are endemic region, we need to follow up these patients, and it's better to start a prophylactic tab doxycycline in all of these cases. So, while concluding, I would say that I was working in a very small setup during this time, and I didn't have much support from the, fancy things were not there. So even if a small setup, meaningful research is possible, if you have a will, there is a way. Stay determined. Thank you.